Tracing, we're going from the trachea and head to where next? Primary bronchi, then the
Secondary.
and then the tertiary bronchi. What's after that? Smaller than the bronchioles. After bronchioles, we have respiratory bronchioles before that. Right. So bronchioles, respiratory bronchioles, and then the tube leading to the sac, right? Alveolar ducts, tube heading to the alveolar sac, right? Alveolar sacs were the sites of what? Gas exchange, right? The actual respiration is just gas exchange, versus ventilation, which is what? Ventilation is breathing in and out. The actual inspiration, expiration. Good, right? Yes.
Does the terminal bronchial come before the respiratory, or does it not?
Great question. I think terminal. It's not part of the K-Dublin sheet, so it's not within the tracing.
Oh, okay.
But it's either, I forgot. It's either right before or right after.
Okay.
So you can double check on your, in lecture, terminal, and then the respiratory. You double check. Right. But for lab, we just need to know about the respiratory bronchioles only. Okay. Excellent. Let's jump around. What is this blood vessel here? Superior vena cava. Superior vena cava. Excellent. Right? That would make these blood vessels here, these ones, right and left brachiocephalic vein. And remember how it was like Y-shaped? Remember that? I read the subclavian, superior vena cava, and the two things tributary into it, the brachiocephalic veins, right and left. Right? Each of the brachiocephalic veins will branch off into what structures? You'll head either towards the arms, subclavian first, right and left subclavian veins first, and then what blood vessels are heading towards the head? The jugular veins, right? Remember, we have an external and internal jugular veins. What was the difference between the two? One goes to the face and one drains the brain, right? That's the difference between the two. Excellent. All right, remember which was which. Remember, we have the same system in the artery, except they're not called jugulars, they're called carotids, right? We have the external and internal carotids, and they come from a common, right? Which is different from the vein system. We don't have like a common jugular vein, right? We just have a straight external and internal. Okay, excellent. So remember the branches off of the aortic arch. Keep that in mind as well. Do you guys remember what this structure here is? This lumpy structure here? Thyroid gland. Good, good, good. If I ask you, what hormone is secreted from here? Thyroxine or calcitonin? We have two possible answers. But if I ask you on the exam, what hormone acts on this structure? I said, remember the question? I said what hormone is secreted from here, which was thyroxine. But if I ask you, what hormone acts on this structure? Thyroid stimulating hormone. Remember that hormone? It was from the anterior pituitary, right? But that acted on this guy. Does that make sense? Yeah. Right? Students always also trip up on that question.
Like what's a target?
Yeah, so like a target, exactly. So the hormone targets this, right? The hormone acts on this structure. Versus what hormone comes from this structure? What hormone is secreted from this structure? Make sure you get that clarified. Don't make that mistake. Okay? Thyroid gland. Excellent. Here we have what? Cartilage, right? Make sure you just don't put thyroid. I have to know that you know it's the cartilage or the gland, right? And just below the cartilage, making these the cartilaginous rings. Excellent. If I ask you on the exam also, this region here, right? Do you guys see this region? What kind of surface of the lung is this region? This is the costal surface. Good. This is the costal surface touching the ribs, while this surface here is the what? Diaphragmatic surface. Excellent. If I ask you on the exam, this surface here, mediastinal surface. Mediastinal surface. Then what is this corner? This corner is referred to as the what? Costodiaphragmatic recess. Okay, excellent. So remember that region has both a costo and a diaphragmatic component to it, right? That's this corner. Excellent. Good job. How many lobes of the lungs are on the right side?
3.
3. Why? There's more space. The heart is scooted a little bit more to the left. Right? Good. All right. Apex space of the lung. Thank you. I almost said liver. All right. Good. What else? Let's do this guy. So this model, right? We had like a picture of it on the KW sheet, right? Remember that? This 3 structures up here are the what? Superior, middle, and inferior turbinates. Nasal turbinates, right? What are the functions of the nasal turbinates? Remember, it was warm, sticky, and wet. Wet. So what were these functions? Moistens the air, transform molecules, and transform molecules is 2, and then warm the air. Moisten, warm, transform molecules. 3 different functions of the nasal turbinates. Excellent. What was this structure here? This structure here is it was that little dangling thing at the back of the mouth. Uvula. That's this guy, right? See how that's dangling at the back of the throat? It just looks different because it's cut this way. Sagittal section. Right? What's the function of the uvula? It blocks off what?
Oral nasal.
Which one? Nasal pharynx. Right? See how this is the nasal pharynx, the funnel-like passageway from the nasal cavity to the throat. That gets shut off by the uvula when you're swallowing. Good. What is this structure then here? Down here is the epiglottis, and what does that shut off?
Airway.
The laryngopharynx, which is the beginning of the
Trachea.
Larynx is the beginning of the trachea. Passageway to that is the laryngopharynx. Shut that off using the epiglottis. Excellent. The epiglottis could be also seen in this model as well. You guys remember this little dingly thing is the epiglottis, right? Same thing. The function of this guy blocks off the airway, the laryngopharynx, the beginning of it, and so food won't go through there. Excellent. Speaking of which, what are these hooky thingies right here? These are the arytenoid cartilages, which are connected to the what? The vocal cords or the vocal folds, right? Or the vocal ligaments. Any of those would be appropriate. What else can I ask you? I already talked about this region, right? Remember this guy, right? Adrenal glands?
Thyroid gland.
Thyroid glands. Okay, cool. Make sure you know what acts on it. That's the question. So make sure you know what acts on it versus what's secreted from this structure. What else can I ask? Oh, before I totally forget, do you guys remember the eustachian tube? The eustachian tube, what was its function? What was the function of the eustachian tube? It equalizes the pressure. Good. Eustachian tube was responsible for equalizing pressure. Okay. All right. Remember. So don't forget that. I probably won't pin it, tape it, but see this corner right here? See the little penciled mark region right here? Right there?
Yeah.
That region is the eustachian tube, beginning of the eustachian tube. This little penciled mark here, right? That's the eustachian tube. The likelihood for my class for me to pin it is low, but I could ask you a straightforward question. Or you know how I made you like mark it on your K-Delvin sheets? Remember I said point to this structure, label as a eustachian tube. I might get the same picture and then point to that and ask you about it instead. Okay. All right. Excellent. What is this structure here? This blue structure is the renal veins. Good, renal veins. What is this blood vessel here?
Renal artery.
Is it renal arteries? Common iliac, right? See how that's the initial split, right? It's part of the urinary system diagram, right, or model, but that right there is the common iliac. Common iliac arteries are going to split into the external and internal iliac arteries. Excellent. Right? Good. Right.
Oh my God, send that to me. Okay, I'll send it.
What is this tube? It's going to be that was too easy.
Oh
If I ask you a question, yeah, no, yeah.
It's all anatomy.
All right. This structure here is the what?
Bladder.
Which part of the bladder?
Oh, yeah.
Is this the trigone of the bladder? The most of the bladder is the what? The body, right? The body, and then the narrowing, the V region, shade region is the vertex. But inside the vertex, if you can see that stretch of triangular shape. Yeah, exactly. The trigon, or the trigony. Right? This region inside is the trigon or the trigony. Okay.
I'm going to.
By the way, do you guys know what this structure here? This is right here. That's the prostate. Remember, the prostate was like a walnut-shaped structure below the bladder, right? Remember, females do not have this. And that's how we know this model the whole time was a male model. Also, does anybody remember what this structure here was? This structure here. That's actually seminal vesicles. Seminal vesicles. Seminal vesicles. I think I pointed it out last week with a different model. That's why you're like, what? But if you see this structure here, right?
There's no point now.
Right? Seminal vesicles, they're going to squirt into the ejaculatory duct, which is inside the prostate. That's how it works. This is the seminal vesicles secreting seminal fluid, right? And what was the function of seminal fluid? Food for the sperm, exactly. Nutrition, right? Food and water for the trip. Okay. Excellent. Before speaking of urinary stuff, right? You guys remember the pathway of urine, right? Starting from the renal pyramids, we're gonna head up to the little tip. What was the tip called? It's the renal papillae, right? From the renal papillae, we're gonna dump our contents into what?
Minor calyx.
That's the first tube. Those tubes lead to a bigger tube called the
Major calyx.
major calyx. Excellent. And all the major calyces are gonna dump into what center region? Excellent. Renal pelvis, and they're gonna dump its contents to the ureter. Excellent. Right. Again, these structures here are what?
Renal arteries.
Renal arteries and veins. What's this right here? Adrenal glands. Excellent. Right. Do you guys see this region here? That's the what region? Cortex of the kidney. Name one structure that's in the cortex of the kidney. Arcuate veins and arteries. Remember that? Arcuate veins and arteries. That's in the cortex. All these little red, blue dots, because they're very small. That's portraying the arcuate veins and arteries in the cortex of the kidney. Okay. This upper region here again is the adrenal glands, right? If I put a tape, which is very likely, up here, right? Right? Which is the what? That's the cortex of the adrenal glands, right? Can you guys think of one hormone secreted from this region? Androgen. And then mineralocorticoid and glucocorticoids, right? 3 possible structures are secreted from this region, right? What's secreted from the middle of the adrenal glands? Adrenaline, also known as epinephrine or norepinephrine. Excellent, excellent, right? That's from this center region, right? Remember this model. Almost guaranteed this guy will be on the test. Okay. Almost. I'm like 99.99% sure. Just in case, we might not. Speaking of today's material, right, I do want you guys to know the locations of the 3 brain structures are in the model, right? Do you guys remember from last quarter, right? Little pink thing. Do you guys see the little pink structure? What is that portraying? That's the pituitary gland, right? Pituitary gland. I'll point to it, and if I want to ask you about the posterior or the anterior pituitary gland, I'll point to this pink structure and ask you about the anterior or the posterior part in the written question. Okay? Because you can't really see the division well in this model. But do you guys? This model is actually a little bit better. Do you guys see this triangular shaped structure, right? This triangle? Right, the triangular shaped structure is actually the hypothalamus. Remember the hypothalamus that we talked about earlier? Right, we had like vasopressin, oxytocin made there, right? It's made here, secreted in the, where? Vasopressin, oxytocin, made in the hypothalamus, but secreted out from the posterior pituitary gland. So it's made here, transferred over to this pink structure, right? Posterior pituitary, and then it's going to secrete it out that way. So it's connected, right? pituitary gland, and the hypothalamus. Okay? Right. Triangular structure. Do you guys see this brown dot here? Puny little brown dot. It must be the what? Pineal gland. This. Oh, sorry. You see the brown dot? If you don't see it, make sure you bug me afterwards so you can see it. I want you guys to see it in the back. Right. So pineal gland secretes what? Melatonin involved with
Sleep.
not darkening the skin. Right? Make sure you don't make that mistake like I did.
I know, I need to go do like everything.
Alright, so I'm gonna pass this just down just to have space
You
here.
had to send me that video.
Oh,
Mine's
do you
gonna kick me
guys?
out right now.
Alright, let me do this model, right? So here, is this a male or a female?
Female.
Female. How do you know?
No penis.
Oh yeah. That's an easy reason why it is a female. But see how there's a right the uterus, right? Remember, this is the uterus, not this. Also a common mistake I see all the time. They say this is the uterus, but no, this is the bladder. Bladder's more anterior. Right? You can almost kind of feel it when it's full. If you poke on your anterior side, right? That would make this tube what? That's the vagina, vaginal canal. At the end of the vaginal canal, what is this? Cervix. What hormone? Acts on it. Estrogen is possible.
No, oxytocin.
Oxytocin is the main one. It's the main one. Right. Good. What is this tube? Urethra. Right. Not ureter. Good. Making this opening to it the what? Urethral orifice. Urethral orifice. Making this right here the vaginal orifice or the opening, right? All right. What is this tube here? This is the rectum, and the opening to it is the anus, right? Good. What is this structure here? That's the clitoris. Remember, clitoris is a type of what? Erectile tissue. Erectile tissue. Do you guys remember the name of the erectile tissue? It's sort of named similar to the guy one. Erectile tissue in the guy, corpus, corpora, cavernosa, clitoris. Right. For females, it's like in males it's called corpora cavernosa, but in the female it's called corpora cavernosa clitoris. It just has the word clitoris at the end. Right. Pretty much the same thing. Right. Yeah. Okay, I was gonna tell you a story. I was like, oh no. The story that I was thinking about was I was watching a documentary like yesterday. It's like total by accident, and it's about a person who has what's called like a persistent sexual arousal syndrome, which sucks, right? Well, because like they're just having orgasm like 100 times a day, like which it's just like it's horrible, right? Like they are like they're telling in there's like speaking in the documentary how miserable they are. Like little things like trigger like any like washing machine vibration trigger. I know, it's just like crazy. But like whole time, right? They were describing that like you know how when you get your thumb like smashed on the door and it's like throbbing, that pain, right? That's the kind of pain that feel in their clitoris just because blood is all the time. It's throbbing pain. They say it's painful. So I mean, I'm just like, what? That blew my mind. I was like, maybe I should share. It's a crazy document. You can see it on YouTube. But not that I'm like, you know, go look at. I know, like if you like your mom comes in the door and you're like looking at something heavy. You guys know the difference between the two lips, right? We have the
Majora, minora.
labia minora is the smaller one towards the middle, and then the bigger one's the majora. Excellent. Good. Here you can see like these finger-like projections. What's the finger-like projections is the fimbriae. Fimbriae. I think I had a 80 model, the better one. I like that one better. Do you guys remember the fimbriae, right? Yeah, finger-like projections. What does that do? It sort of helps. Yeah, exactly. Right. By it's gonna go in and catch the ovum that's spit out from the ovaries. Right. Ovaries is the site of egg production. Right. Do you guys remember this line right here? And then I point to this structure. I want you guys to see it. What is this structure here? That's the ovarian ligament. Another common mistake that I see is that people say the ovarian ligament is the fallopian tube because it's the tube connecting the ovaries to the uterus. But make sure you don't put that because the actual fallopian tube has the fimbriae.
Can you repeat that one more time?
This structure here, do you see that? That's the ovarian ligament, not the fallopian tube. It connects ovaries to the uterus, but it's not. It's just the ligament. Fimbriae, fallopian tube. Okay?
Got it.
What happens here? What's the structure and what happens here? And what happens in the uterus? So this side of baby development. Right? Baby develops in here. And you can see the little baby. Gives it away. Again, cervix, right? Donut-shaped structure on this model. Okay. What is this structure here? This right here is the what? That's the broad ligament, right? What's the ligament between the ovarian ligament and the fallopian tube? Mesosalpinx. Mesosalpinx. I was saying to my students that I think it's one of the hardest words, the hardest structures to sort of remember. Everybody don't remember the mesosalpinx, but I think if you remember it, you're in good shape. You're doing extremely well. Right. What else can I ask? Let's do the male reproductive system. Alright, so
My arm's gonna
where is that? There you go. Do you guys all remember what this structure was here? This overall structure is the spermatic cord. Remember the spermatic cord? That's this guy right here. Right? Spermatic cord, 5 things. Spermatic cord, what were the 5 constituents of the spermatic cord? Vas deferens. Testicular veins, arteries, and nerves. Make sure you put testicular. I have a lot of students that just say artery, veins, and nerves. That's not correct. It's not detailed enough. And then what's the last structure? Lymph vessels. Lymph vessels, excellent. Lymph vessels, right? 5 structures that makes up the spermatic cord. Right? Let's talk about the journey of the sperm, right? The journey of the sperm, mnemonic for it was 7 up, right? The first S being what? Seminiferous tubules, little tubes located where? They're inside the testes, right? Seminiferous tubules, right? After seminiferous tubules sends its initial sperm to next the epididymis, right? What happens in the epididymis? Tail attachment occurs in the epididymis, right? After the tail attachment happens, continuation of the epididymis is the what? Vas deferens, right? The vas deferens is going to continue all the way up, and it's going to go all the way deep back behind the bladder, right? So see how, let me bring out this guy again. See how this is sort of this, right? Can you see the similarity, right? So this tube right here is what? That's actually the vas deferens, right? Like here, right? So if I ask you about this tube, you know that's the vas deferens as well, right? Seminal vesicles. What vas deferens, continuation of it is the what? What's after it? Ejaculatory duct, right? And that's located where? Inside the prostate. So if I open this guy up, right? Do you see this tube right here? Right. Do you see this tube? Make sure you see it. This structure here, right? That right there. This little tube. You guys too. That right there is going to be the ejaculatory duct. Right? What's contained inside the ejaculatory duct? What runs through there?
seminal fluid and sperm.
Right? Semen, which is sperm plus seminal fluid, right? So semen is inside, right, the ejaculatory duct. The first 3, right, seminal vesicles, epididymis, vas deferens, only contain sperm. Only contain sperm, right? So the next structure after ejaculatory duct is the what? Nothing, then urethra, right? Remember, urethra is this tube running down, right? What runs through the urethra? Urine and semen. 2 things run through there, okay? And then exit out from the penis, right? If we take a peek at the penis, at this sagittal section of it, can you guys see how there's this white part and like a purple part? Do you see that? Do you see that? There's like a white part and a purple part, right? These are the different erectile tissues. Remember how we saw the erectile tissue a little bit differently last week? We saw like a cross section of it, not like a sagittal section, right? This then is going to be the top erectile tissue. And what is this erectile tissue? The top one is going to be the corpora cavernosa, the really cavernous, really big erectile tissue on the top. making the bottom one the what? Corpus spongiosum. And what's the identifying feature? Your urethra. Urethra, you know that urethra runs through? Okay, it has to be corpus spongiosum. Okay, right? You can see the entire glans penis is actually made up of corpus spongiosum. The erectile tissue of the entire glans is actually spongiosum, which is kind of interesting, right? Sort of. Alright, excellent. So within this entire tubing, right, we have accessory structures that sort of secrete material into that tubing, right? The first one we already talked about, which was seminal vesicles, supporting out what? Seminal fluid. Right? What was the other structures? We had a different gland. Well, I'll start you with one. We had the prostate gland that secreted out. Oh, not the prostate gland. It secretes out. It secretes out what? Prostatic fluid, right? We don't know the function of the prostatic fluid, but you just have to know prostate secretes out prostatic fluid into the tubing. That's all I want you guys to know. But the other gland is the what? Bulbourethral gland. Bulbourethral gland secretes out what? Pre-ejaculatory fluid. And what was the function of the pre-ejaculatory fluid? It's going to clear out the urethra by neutralizing the pH, right? Because it's kind of acidic, urine, right? And it also provides lubrication. And I looked it up, I was like, oh, also lubrication. Good stuff. They're good stuff. I don't know. Yeah. Awkward. Okay. Oh yeah, before I forget. The layers of the scrotum, right? Do you guys remember I was emphasizing two particular ones within the layers of the scrotum? The external-most layer of the scrotum was what? It starts with a D. It provided the wrinkly appearance, yeah.
Oh, the day toes or dark?
Dark toes. Dark toes? Tunic. Good. The dark toes tunic. That was the structure within the scrotum that gave the scrotum this wrinkly appearance. A little bit deeper to that, we have a special muscle called the cremaster muscle. Right? Remember our cremaster? What was its function? Drops it like a hot. Right? It lowers and raises the testes depending on temperature. Right? Excellent. Excellent. Good. Beautiful. What else can I ask?
Are the arms and legs gonna be on there too?
It can be possible. Let me go ahead and grab this. Alright. The only structure, I don't know if you can see that. So, remember the blood vessels in the arm is the what? Brachial, right? Brachial, it's arteries, right? The red. They're going to. You can't. Well, I'm not gonna worry about the axillary, just because it's sort of in a vague location, right? But in the forearm, the blood vessel leading to the thumb is going to be the radial artery, and then the one leading to the pinky is going to be the ulnar arteries. Good, right? If you want, you could go ahead and check out the leg model as well as the. You guys know the big red muscle guy in the corner, right? Make sure you check out that model and look at all the blood vessels in him and see which ones are which and how much you can name, because we could name a ton from that model alone. Okay. Edwin, actually, can you grab the nephron model behind the gentleman? I'm going to go over the nephron because that's going to be on excellent. Excellent. All right. What is this structure here? This is the where? Bowman's capsule, or the glomerulus, right? The whole thing is a glomerulus, right? Each of the glomeruli are connected to the yellow tube that's close to the glomerulus. What was it called? Proximal convoluted tubule. Crazy tube close to the glomerulus. Proximal convoluted tubule, making this dip U-shaped structure. What is this? This is the loop of Henle. Excellent. And the continuation of it, the white tube is the far away distal convoluted tubule, right? Distal convoluted tubule, and they all come down to become this structure, which is the collecting ducts, right? Series of collecting ducts become what structure? Renal pyramids. Excellent, right? while a series of the loops of Henle become the renal column, which is just the space between the renal pyramid, right? Excellent. Good, good, good. What hormones acts on this structure? ADH, which is also known as vasopressin. Excellent. Any of those would be acceptable. Antidiuretic hormone or vasopressin. Good job. All right. I think we're pretty much done with the review. Actually, make sure you review the EKG, right? Do you guys remember the EKG? We had the right? Remember we had like the first hump, which was the P wave. The crazy thing in the middle was the QRS complex, and the last hump was the T wave, right? Make sure you remember which component is representing what system. Atrial depolarization, and then opposites in the middle, etc., etc. Remember those. Make sure you also remember the lung volume system, right? Remember there was an equation, right? The total lung capacity equaled, VC plus RV, vital capacity, right? Do you guys remember what the vital capacity was? One time, right? So the whole expiratory reserve, inspiratory reserve plus tidal volume, vital capacity, right? RV was the residual volume, right? Make sure to remember that equation because we will have one math question in the exam, right? Okay. I talked about it. I practiced with you guys once. So, what else? What else? This region of my arm is called the what? Cubital fossa, right? Remember, and that's where we put our stethoscope to listen to for our blood pressure reading. What was the? That's a hard question. What was the blood pressure cuff called? Sphygmomanometer. Good. Do you guys remember that triangular? Gave it away. That space in the back where you put the stethoscope to listen to your internal stuff.
Triangle of osculation.
Is it
osculation.
Osculation. Triangle of osculation. Right. That's the location in the back where you dense muscle, right? Or minimal muscle. Opposite of dense. Okay. Excellent. All right. So what I'm gonna do at this time, I'm gonna go ahead and start calling people towards